So my first joke is I wanted to be a vet, but I thought it'd be easier to marry a vet, which I am married to a vet, than it would be to become one, and I was wrong. So actually, it really was wrong. Okay, so it's hard to follow Liz. Darn it! I asked her to do a lousy job, and I could get up here and kind of coast, and now I can't coast. All right. So innovations in publishing veterinary evidence. So I'm going to introduce three things during this talk. I'm going to introduce a journal. I'm going to introduce a library, and I'm going to introduce a conference. Three things that are actually really one thing under one title, and that is Veterinary Evidence, our new journal, the EBVM Network Journal. Now, I should say that I got this three-square idea from watching Steve Jobs introduce the iPhone. And when he did this, everybody applauded, so I think we should at least, they were very enthusiastic, and, So anyway, so this is our new journal, which is this sort of conglomerate of different things, all under the same title. So it's not your dad's old paper journal. So I'm going to skip a few bad jokes comparing Americans to American English to British English, but I will say that it's pretty sad when our Greek director of digital communications, our computer guy, has to correct my grammar or my punctuation, because I would always put a period after the doctor, and here you don't do that. So that's how much uphill battle I have. Now, this is the outline of the talk. I'm going to talk about how veterinary evidence is different from other journals. Then I'm going to talk about how we're really different, because we are really, really different. I'm going to segue after that into how to write knowledge summaries, which are sort of a key component of the journal, and tell you how to publish in the journal as well. Explain the editorial process, and then what we need to do to keep going on. So one of the things that makes us a bit different from other journals, from veterinary, when I say journals, by the way, I mean veterinary journals. So I'll just skip that part, is that it's open access. The great thing about open access is that it liberates information. Now you can all, there was a discussion earlier about where can we get our information? How do we get it if we don't have library access and so forth? And of course, as it was pointed out, you can get library access through RCVS Knowledge, but this you won't need to. This will just be open access. Click on it, download the PDF, or read it on the screen. Hopefully that will drive readers to this journal as well as helping the readers, it'll help the journal. Now, it really makes a big difference too, because this is a chart of the percent increase in citations with open access. If we scroll down to sort of our cousins in medicine, 300 to 450% increase in citations with open access, which makes a lot of sense, because if you can't get the paper, you're not going to cite it. And if you can, you're going to cite it. So we're really excited about this aspect of the journal, it being open access. It's probably one of the very few in veterinary medicine. There's a few more now coming out, but not many. What's really different about us is our peer review system. So this is going to have open peer review. Now, the classic way, if you were to send a paper off to JAVMA, is that the reviewers wouldn't know who the authors were, and then the authors wouldn't know who the reviewers were. And they would be reviewed that way. But there's really no evidence that system is any better than any other system. And in fact, studies have shown the opposite. Blinding is difficult to achieve. There's been a couple of studies, but blinding is difficult to achieve, and in many cases, reviewers could identify the authors in about a quarter to a third of the cases. And I bet it's higher in veterinary medicine. I work a lot with a lot of orthopedists, and they know precisely whose paper they're reviewing every time. They've talked to them about it last week at a conference, and all of a sudden the paper shows up. So there's really no blinding in these subspecialties, I don't think. And of course, even blinded, these studies showed, there was no evidence of improved quality of review. So I think this open reviewing is going to be really a good thing for the journal. How it will work is that we'll get the manuscript, we'll send it to reviewers. The reviewers will see who the authors are, but we won't tell the authors right away who the reviewers are. I mean, we could, it's just a logistical thing, but when the paper gets published, the knowledge summary or whatever, the reviewers get their name next to the document. So they can get a little bit of credit for it if they want it. It does, though, it might slightly reduce the number of people that want to review, but not by much. Studies have shown it's not a very big number. Now, that's the sort of the analytic reason why it's nice to have open peer review. But why I like it is this reason. You know, I think I have about 120 published manuscripts now, published articles, peer-reviewed ones, and it's an adversarial process. I mean, a lot of people aren't nice when they don't know who you are and you don't know who they are. And that's an impediment to sending information out. You know, if you're sending off to a reviewer, presumably that reviewer is an expert in that field. They should be helping that publication, and some manuscripts can't be helped. I mean, they're just beyond, they got a fatal flaw. They just gum something up, you know. But we don't have to be that way. I think we want to be helpful. And I think that's another big difference with this journal is that we're trying to not trying to publish junk, but if there's a good paper that was written by someone maybe whose first language is not English, or they're inexperienced, heck, I have no problems helping that get published. Yes, another one, how we're different, let's keep going here, is the copyright. The classic journals, you know, once you give your paper to them, they own your paper. It's your manuscript, it's your article, you get to keep it with this journal. So it's a classic, you can look at the sort of legal jargon here. You go to the Creative Commons copyright website and you can read the sort of the fine details. This is actually very helpful too because some of the conferences require longer abstracts, like one of the equine conferences back in America requires long abstracts. Well, if you put a long abstract in, you might not be able to publish that in some journals. The final paper, it's got to be under like 250 words. If your abstract's over 250 words, then you then can't publish the paper in that journal. So here it's yours. You can do what you want. If you want to send your paper off to a friend, you know, you own it. Now, we'll also have a very broad content here. So we'll have methodological articles, we'll have primary research, what I call post-primary research. That would be things like meta-analysis, systematic reviews. As I mentioned in some of my earlier talks, my wife had this idea, which I thought was a great idea, which is she did a randomized controlled study of some knee surgeries, and it was written in a way that was sort of technical and not very practical in the sense that you wouldn't really know. She showed which method was better, but not the magnitude. And so she wanted to rewrite the paper for practitioners, sort of like a clinical summary. And she wasn't sure if she should do that or if she could publish that. I thought it was a great idea. Well, I don't think JAVMA would publish that, but I know they wouldn't. But I think we sure would because, gosh, if we're helping a practitioner decide if, or for that matter, clients decide if a TPLO is better than an extracalcular procedure, then by golly, we should do that. So I call that post-primary research. Also, I think we'd publish things with P greater than 0.05. So another friend of mine last week couldn't get interesting paper. It was on injuries. So there's a big dog sled race in Alaska called the Iditarod. Maybe you're familiar with it. It takes days and days and days. And they were looking at sort of what causes dogs to drop out of this race. And some of their p-values, a bunch of p-values were above 0.05. So JAVMA, again, would not publish it. First of all, it's just cool. And secondly, I think we need to publish more studies with p-values above 0.05. I mean, we're always showing interventions that work, but not ones that don't. So we'll do those. Plus editorials, comments, interviews, and even, you know, cartoons. If you got a good cartoon, why not, right? Piece of art. You know, we're not trying to be silly and not trying to be funny or make this sort of a tabloid. But if it will help practitioners and if it will help researchers, not definitely. It should be considered to go in. Now, this was Nick's idea, so I have to give credit where it's due. He suggested we do something like what we've called now evidence action rating. So what this is sort of a two-digit score, a letter and a number, and the letter scores the evidentiary value of the article. So if it's a randomized control, it might be an A. If it's a prospective study, it might be a B. And then the clinical significance of it. So if you're evaluating an article, just reading it, let's say as a reviewer, or if you're writing one, you say, well, hey, this is a systematic review. So, and you know, we have this on the website. But if it's a systematic review, it might get an A, or should get an A. And then if the clinical, but maybe it was sort of weak clinically in the sense that the clinical value, it wasn't a big change. Well, in that case, maybe it gets a lower on the clinical significance. So for those of you who saw my talk today, an example of that would be this big aspirin study that was done, where they had 22,000 subjects, 11,000 in each group. But you remember there was that small clinical effect. So aspirin really didn't help preventing heart attacks. That's a case where it maybe get a lower rank on the clinical significance, even though there was a difference. Oh, we're going to try and get fast turnaround times. That's something that's been really, the other open access journals like PLOS One have really kind of ramped it up for everybody now. But that's nice because it keeps the information up to date. And for authors, I mean, my gosh, the guys I talk to, they're just miserable with these sometimes 2-year turnaround times. Now, possibly the best part of this journal is the way it's been set up. Now, think about how you would set up a journal if you were to do it. You'd think, okay, well, I have a great idea for a journal, and you would start it. That's not the way it was done here. Here it was like a grassroots sort of thing, where they got the EBVM network, so it's 1,000 people. And then from that 1,000 people, they developed these knowledge groups. I'm sorry this is hard to read. This is just a screen capture. But the blue is sort of things like surgery, vaccinations. I know this is, like I said, a screen capture. Laboratory animals, dermatology. So these topics. And then people have volunteered to be, these are knowledge groups, to be knowledge group chairs. And they serve as the editorial board. And we're always adding new knowledge groups. So even today, we added a new knowledge group. And some people volunteered to be the chair. So what I will do, for example, is I will the journal will get a submission. We'll see where it lands. Maybe it's a surgery one, maybe it's a vaccination issue, maybe it's a lab animal. And then I'll email one of these folks, and I'll say, hey, do you know someone who can review this? Oh, by the way, another difference, which I'll talk about a bit later too, is that it's pretty common nowadays for authors to suggest a couple of reviewers, and also to suggest people they don't want to have reviewed that. And we'll have that too. So if you're submitting something and this person despises you, but they're sort of a big person in the field, they're likely to be a reviewer, you can ask that they not review it. Anyway, we have these knowledge groups, and these are the chairs, so do that. I try and email them. I'm going to try and email them about once a week, but they're also going to help provide knowledge summaries, which I'll talk about in a minute. But knowledge summaries are short, critical appraisals of a sort of a clinical topic, and they're going to help provide those too. In summary, it's a broad, open, and transparent journal. But now I'm going to talk about how we're really different, because this is where we really diverge. There's sort of other journals out there with bits and pieces of those things. One of which is the priority survey that we're doing. This survey, this is a formal survey. This is sort of a big deal, where we're going to find out what we don't know about veterinary medicine. These are going to be common, common. We're going to find sort of the common problems that we don't know anything about. And then we're going to try and target those for knowledge summaries. So this is actually not only is just doing this different from a journal, if someone wants a project to do, like a student, like you've got a student, they need a project, we'll give you the problem. Here's a knowledge summary that you can write. Or if you know someone, or if you want to contribute, like, man, I feel like my career's going along great, I got a bit of time now, I've listened to what Liz said, and I'm making a lot more money, I got a lot more time now, well, you can spend it writing knowledge summaries. Again, another place we're really different is our library, because the library staff is absolutely awesome. I see Henry's there, and Claire's probably here somewhere too. And May, they're in the back, I guess. Yeah, so they're awesome, and they will help you search the literature. So if you want to write a knowledge summary, you can send your search, how you think your search criteria to them. They'll say, well, you know what, here's what you're missing. And they'll help you get that. Again, we're trying to make this as easy for authors as possible. So we have over a dozen learning modules. I think it's kind of like worksheets. Worksheet learning module, kind of a crossover there. A dozen of these things on how to search the literature and how to appraise articles. So if you're doing any kind of post-primary research, this is a great resource. And you can sort of find the one that you want, download it, download them all, They're in different places, and I'll say some more about that in a second. It's becoming sort of no excuse not to do these, I guess. So we've also provided a handbook. This is about 60 pages that's got checklists. So it has A to Z on how to publish, just for knowledge summaries, not for if you're doing a laboratory or a materials testing study. But this is for knowledge summaries. It has checklists on how to write them, how to publish them. It has some extra material. It has some explanatory material, like regarding the evidence action rating. It's got all the toolkits in there. So you can go to the website now and download it. And it's PDF. Go through there, and it should have everything that you need to know about how to publish knowledge summaries at Veterinary Evidence. This has already been covered today. Kristen and Marnie. So the website with the whole learning system, which is a great place to start. So I won't cover it because we already had a long one on that, but there you go. This is awesome. So we have 8 prizes available. I just cut and pasted off Nick's sheet that he emailed me, one of them. So this is one of the 8. This one's called the Spencer Hill, to be awarded to the best suite of 3 related knowledge summaries in the field of farm animal health. We have ones for cats, dogs, other things. There's 8. But really, these are huge prizes. 1,000 pounds. And we go down to 3rd place, too. So this hopefully will motivate people to write 3 knowledge summaries. And once you've written the first knowledge summary, I think it would go pretty fast to write the other 2. I mean, these aren't, and don't. So I have a 17-year-old son who's he's kind of a big slacker. So what he would do if he had to write one of these is he would find 3 clinical questions that had no literature at all, and say, "Hey, no literature, no." So since it is an award and there's prize, probably someone who puts more effort in is going to. So he would get like 4th place. Okay, so it doesn't pay to be that much of a slacker. So no, but. I'm really excited about these because money's always a problem in veterinary medicine, whether you're trying to, from Liz's end, running a business, or you're a researcher and you're thinking, where am I going to, how am I going to buy my next whatever, computer even. So, yes. So, you've written your knowledge summary. You've sent it to us, and it's going to get published, or your primary, whatever it is. Your cartoon? I don't know. We've got, I don't know if Tara is here. Tara's one of our communications people. She will make sure that everybody knows about it. Wow, that's great, because now you're going to get cited. We're going to get cited. And then someone's going to, someone who didn't know it was out there is going to find out about it and read it. So it's great. This is a win-win for everybody, having someone who knows social media plus old-fashioned media and can get out the fact that you've just published something. Because I'm sure you've all had the experience where you've been talking at a conference with somebody, and then someone says, there's a paper on that. And you didn't know about it. Well, now you'll know about it. And our conference, you can go to the website, but like I said, there are 3 things: the journal, the library, which is sort of this collection of knowledge summaries, and then, of course, the conference. We're ready for abstracts, so send them in. So in summary, this is really a 2-way street. It is your journal. So we're here to help you and publish, publish, publish. So now I'm going to change gears a little bit. I had to think of a transition slide. This is the best I could do. So transition slide. So I'm going to talk, since I've been emphasizing these knowledge summaries, I thought I'd just quickly run through how you do one of these. Even though we've got lots of resources online. The handbook is probably a good place to go, where it's got the toolkit on how to write these, and it's got checklists on how to write these. But just so I have a feel for it. So hang on here, I got to these animations. Here we go. So think of I hope you can read that small font. Sorry, but think of a question based on a clinical scenario, or we can give you one. So you're in your clinics, you always wondered why you did something. Or you just hired an associate, and they learn differently, from 10 years ago when you were in vet school. And which is better? So now you've got yourself a clinical scenario. Or we can give you one from the survey. Sorry, I'm going backwards. That's not the way we want to go this time of the day. We want to go forwards. Come on now. All right. Now, of course, a very broad question is hard to answer. So you can refine the question and make it answerable in these PICO questions that we talk about. Again, we have a toolkit for that. You click, download that, get the handbook. Handbook has all the toolkits in the appendix. You can find out how to make these questions sort of more organized in the way that a researcher would ask them and then therefore publish something. Search. You got a toolkit on how to do a search. Write your search down, dog or orthopedic or knee or, carpus, whatever. Then you send it off to Henry. Henry says, oh, that's perfect. That's great. Or, you know what, that's perfect, but you only went to 1980. You need to go to 1973. We're here to help. Once you've got that, you get your 1 month free library access if you don't have it. Get your literature. Critically appraise the search findings. So again, we've got a toolkit for randomized controlled trials, a toolkit for prospective studies, and so on and so on. To help with that, you write your knowledge summary. We have a template. You simply take the template and fill it out with what you've learned from your search, from your critical appraisal, and then submit. I made it sound pretty easy. Now, I put a week calendar here because we were having a discussion in the office about how long should these things take to do. And we were thinking if you're working during the day and you want to get one of these done, because it's not hard to procrastinate. If you're working during the day, it might take a week. You think of the question on Monday, maybe come home, to the office, maybe come home, download the toolkit on how to write a PICO question, kind of think about it in the shower, right? Write that down. Next day, download this search strategy. Spend an hour on that. Email it to Henry. Maybe it takes a day. So maybe it's a bit longer in a week that way. But really, it could go once you've done one, they're going to go fast. The reason why I put up a rough timeline like this is only because systematic reviews, which people are familiar with, maybe take months and months. These are fast. And in the handbook, I actually have sort of the difference between a systematic review and a critical and a knowledge summary, sort of a box thing that describes the differences in more detail. All right, so you want to publish. Okay, so you've written this sucker, and now you want to publish it, whatever it happens to be. So you have to register or log in and upload the manuscript. And here's, of course, I have it on every slide, but here's the website. You can suggest your reviewers and the ones people you don't want to review. It'll go out for peer review. We'll get the reviews back, and I'm going to read everything because clearly, from the reviews I've gotten back in the past, the editors have not read them. One paper, I think we were accused of faking the data. Who would say that? It's ridiculous. And so, luckily, I wasn't the lead author, and the lead author has, first of all, not as much of a temper as I have, and so that was good. And he was calm and collected, and he sort of straightened the whole thing out. But people can just be crazy. So I'm not going to let anybody say that you faked your data or that you did something. I won't do that. Okay. Yes. Then maybe it goes back to you because it needs a minor change or major change. Goes back through the process, hopefully fairly quickly. Well, when I say it's proofed and sent back to the author for a final look, we're really trying to minimize this step. We do not have a large copy editing staff to go through and check all. That's why we have a template. The template's supposed to make it so that it's not a big hodgepodge. The good news is, though, is that mistakes can be fixed. I don't know how often you guys read online news stories, but at the bottom, there's often a few places where if there's a mistake, it was just fixed. It's not a big deal. So, and I'm not talking like a major thing like papers, but hopefully the reviewers will catch. There's not like typos, things like that. Things that aren't big deals. We can just fix those, just like in an online. See at the bottom, this was changed on this date, and there you have it. So it's not a big problem if you go back and look at it. Kind of a funny story. I used to write for the oldest sailing magazine in North America. It's been around for 50 years, and and we had a 12-step editorial process to prevent typos and things like that. I pick up this one issue, I open it up, the first word I see is a typo. So I mean, it's easy to happen, and it's easy, for us, it's not a big deal, easy to fix. Okay, then we publish it, put the reviewer's names next to it, so they get some credit, and that's it. Goes online. I'm hoping to do all this in 20 working days, which is it was very possible. I just was asked to review from one of the big general science journals, and they wanted the review back in 10. Well, if I get the review back in 10, send it to you guys, especially if it's something smaller like a knowledge summary where it's unlikely to have major tons of revisions, then I think this is reasonable. Think of that compared to 2 years. Now, what do we need to do? Well, we need to get listed on PubMed and other listing services. That's not that hard to do, but it does take time. For example, for PubMed, you need 50 manuscripts published to sort of send to them to make sure you're kind of a legitimate operation. So that's not too bad. We need to get approval from specialty colleges. So I'm not sure, for example, that the specialty college in America for the surgeons, if their residents have to publish a research project in order to get boarded, to become diplomats. And I'm not sure that if they published here, that would happen. So we have to get approved. This is just a process. Impact factor, sort of a big deal. But that takes years to actually get. It takes 2 years even to apply for it. So that's on our radar, but that's not something that we can handle right now. There's also lots of other metrics we're going to measure along the way. So journals, libraries, and conferences, i.e. Veterinary Evidence, needs content. It's your journal. Send in what you want to read and what you think other people should read. It really is you have 1,000 people in the network, of which I'm sure many of you are in that. Now, I have a couple minutes. I think, do I have a couple minutes? Or am I done? I have 1 minute. Perfect. Fast story, true story. Do you guys have this TV show over here? Dr. Jeff? Okay. So Dr. Jeff, Rocky Mountain Vet, I guess he's in Colorado. It's a reality TV show. They follow this guy around. And he can do anything from neuter a musk ox, and the next minute turn around and be doing some cat surgery, right? So he does, just kind of crazy busy practice. It's, like this. So my wife, as I said, is a boarded small animal surgeon, and she has a PhD. So I said, let's watch the show and see what happens. So we watched the show, and so one thing he did is he took a dog, and the dog had a mass on its leg, under the skin. So he opened it up, he stuck his fingers in, and he said, "Oh, that's cancer. This leg's got to come off." Okay, all right. So then, while he was taking the leg off, so we have drapes, right? We put over that, maybe call it the same thing here, just the thing over the dog. He didn't wear a gown. He had gloves on. I don't remember if he had a mask or not. But then he touched his elbow onto the drape, his bare elbow. And then on another surgery, he reached a nurse reached over who just walked in the room, reached over to the surgical site just like I would do right now, like this bare skin, like this. And my wife at that point said, "Okay, I can't watch this anymore." And she was in a good mood that night. So I said to her very nicely, "Yeah, but do those things really matter? Right? I mean, just touching an elbow on it, and so luckily she was in a good mood. So she was like, "Well, I don't know. I mean, certainly can't help doing that, right? But do those things matter? So really, let's find out. This is what the journal's for. Let's find out if those kinds of things matter." You can get a hold of me. There's my email. Some of you have my card. You can Skype me, although there's a 6-hour time difference to London. And I'm happy to, and then Liz can answer questions too about her talk as well. Thank you.
Thank you very much, Rich. As you can probably guess, we're pretty excited about all this. You guys leaving, don't forget your feedback forms. Thank you. Okay, we've got a few minutes before we wrap up, so we've got time for a couple of questions each, I think, for Rich and Liz. I'll kick us off if I may, because I had one, and it's a question for Liz. You were waving around your store cards earlier. Here's the question: do any vet practices actually, or maybe the bigger corporates, do any of them actually have loyalty cards yet, and is that something you see happening?
It would be really nice if they do. I think that for me, the next level in terms of complexity down, which I also have in my purse, is the stamp card, which I think is much more common for pet food and pharmaceuticals. You know, you buy 9 and get 1 free. That's very customer orientated and client focused. The downside is that it doesn't give you any data about your clients. So that could be a halfway mark to go. But if any sort of loyalty cards where you're collecting data is a big win. It's a really, really, really big win.
Thank you, Liz. Now, have we got any questions from the floor? And if you have, put your hand up. We'll pass you a microphone, and you can ask your question. Anybody? One of you? Somebody who hates empty... here's one. Right. Lady in the middle there. I was going to leave an empty gap there because somebody always steps into it. Okay, question.
My question is for Liz. She put up a slide that said 60% of veterinary managers don't value their internal customers. Did I get that wrong? No, 60% valued their agreed that they valued their internal customers.
Is it possible to go back to my slide? The slides were talking about to what extent does management agree with that statement versus how much do staff.
That's right. So you had management agreed, 60% of management agreed.
Strongly agreed. Strongly agreed.
That they valued external customers more than internal. I think that was what it was. And what I want to know is, why do 33% not value their internal customers? I thought that was terrible.
It is terrible. It's awful. So, it's absolutely awful.
And that's what they admit to it, you know?
No, it's, well, first of all, it is what they admit to. But I suppose even in answering that question that way, it's really, you've asked a very, very, shocking, you've raised a very shocking point that, there are people who are quite happy and quite open to say, and I mean, without wanting to go into the psychology of survey design and all that sort of thing, if you sort of turn it around, there is this enormous belief that your client is number one. Every now and then on Facebook, on my Facebook, there comes up a picture of Richard Branson. Somebody has liked this picture of Richard Branson, and it says there's Richard Branson, and along the side of it, it says in quotes something along the lines of, "Customers are not the most important part of your business. Your staff are." And you've seen that? Yeah. And it's true. But this sort of mantra that customers and clients are everything is not the full story. And I think there's a lot. I mean, I know even in the university system, there's a lot of people who still don't understand that students are they're paying a lot of money, and we need to give them a different service than we used to.
Thank you, Liz.
Thank you.
Thank you. Who else have we got? By the way, I just noticed Brian Pound, who runs CVS, wandering out at the back, and I'm sure I could see loyalty card written on a piece of paper in his hand, so expect that one any time soon. Have we got anyone else who wants... Celia, is that a hand up, or is that just solidarity? Good. Hello.
Hi. Another question for Liz, slightly facetious, but I was very interested to hear about the one patient that had presented itself to the practice for treatment.
No, me too.
Could you tell us about that?
Yeah. What happened, I sort of prance around, with this idea of, your clients, your clients are so important because pets will never bring themselves to a vet. And one of my most favourite colleagues in the world, who's a vet nurse, Hilary Orpert, I was saying that to her one day, and she said, "My dog did." God, she's very, very, very straight down the line, and she lives not far from the Queen Mother Hospital, and her dog, which is now deceased, not because of this particular event. Something happened to it, like I don't know, it ran through a fence or something. And at the RVC, we're allowed to bring our dogs to work. And this dog knew where Hillary worked, but this dog was at home that particular day. And yeah, it broke its leg and hauled itself from Brookmans Park to the QMH with his broken leg. And yeah, sat there basically saying, I'm here, help me. But that's the only, that's the only one I've ever heard of. And I wish I could remember the name of the dog, but I can't. And I have to try and remember what actually happened to it, so I have to speak to Hillary. But yeah, no, that's, true story.
Okay, his name was Rover, and he was a German short-haired pointer, and I might have made that up. Okay, anyone else? Anyone else got any questions? I think we've got time for one more before we wrap up. Nobody at all? I've left a pause just to help. Good. Thank you very much, guys. If you want to take a seat.